Hi, my name is Karen. I'm a trainer here at the Princeton Club, and today what I'm going to show you is how to use a foam roller. There's a lot of benefits using the foam roller to help before you work out, to help with some of the muscle soreness and to increase the blood flow within your muscles, or you can do it afterwards, and when you do it afterwards, that's to help some of the muscle soreness that you after you perform some kind of an activity. There's two different types of foam rolls that we have. We have the white one and we have the black one. The black one is a little bit more dense and it's a little bit harder on your muscles. So it depends how sore you feel. You might want to start with the white one and then go to the black one. Today I'm going to show you how to foam roll your legs. So we're going to start down at the calf, we're going to do your hamstring, we're going to work on your glutes, the IT, and the quadriceps. So I'm going to use the black one today. And what you're going to do is I'm going to do everything on my right side for you. So I'm going to put the foam roll down on the ground, and then I'm going to put it on down by my ankle area. You're going to push it all the way through so I can use my other leg to kind of hold myself up. So I'm going to prop myself up on my arms. My glutes are going to be up. I'm going to start rolling all the way toward my knee. I do not want to go over my knee joint. I just want to roll to it and do my gastrocs and my calves. I start with my toes up. You roll about 5 times, 5 or 10. What I'm looking for is a trigger point. A trigger point would be where you feel some muscle soreness. If you feel that, you're going to just hold it, see if it releases, or you're just going to keep rolling. Then after you do that 5 times, you're going to bring your toes in, work on the outside of the glute or the gastroc muscle, and then you're going to roll it to the inside, at the foot out, and you're going to get the outside after we do the inside muscle. After you're done rolling that, then you're going to bring the roll back up. You're going to put it right underneath your gluteals, kind of I call it the sit bone muscle. And you're going to put it there, and I'm going to roll it down toward the back of my knee. Now I'm going to do my hamstrings. So I'm going to roll it down. My toes are still going to stay up. I'm still in my same position. I'm going to roll it down to the back of my knee, and I'm going to roll it up. Again, I'm going to see if I feel a little trigger where there's some muscle soreness, and I might hold it. If I don't, I'm just going to keep rolling. You might have some soreness, you might not. It all depends. Then I'm going to roll my foot out, or I should say my foot in, and get the inside of my hamstring, hitting a little bit of my adductor muscles. Then I'm going to switch, and I'm going to roll it, and I'm going to go to the outside. I'm going to hit a little bit of my IT band, but it's going to be more on my outside of the hamstrings. After I do that about 5 to 10 times, then I'm going to now sit on the roll. Now I'm going to get my piriformis. Your piriformis is a little muscle that's right underneath your gluteus maximus. So I'm going to take my right leg, I'm going to cross it over my left. I'm going to lean over to my right side, and then what I'm going to do is I'm just going to roll back and forth over that muscle. Sometimes what happens when you have sciatic pain is due to the piriformis, which is inflamed, and it causes some muscle soreness and you have the sciatica kind of flaring up. Again, if I feel something, like a trigger, I'm going to hold it again, and then I'm going to just keep rolling over there. And you'll do that about 10 times. So whatever you feel. There's no number, 10, 15, whatever you feel you need to do. Now I'm going to go and I'm going to do my IT band. So I'm going to go onto my side. So what I'm going to do is go right at my hip joint, and I'm going to take it down to my knee. My top leg is going to cross over my left. My bottom leg is going to be, my right, is going to be down on the floor. I'm going to keep myself up, and I'm going to just roll myself using my hands and my leg, rolling it down to the knee. Now if you're taller, you might want to take this in segments. So what I mean is I'm going to start at my hip joint, take it halfway down, and roll there for a while. Then after I do that, I'll take it from where I ended and then finish up going toward my knee. And then you'll roll that 10 times. So now our last one we're going to do is we're going to do our quadriceps. I'm going to do 2 legs. You can do 2 legs or you can do 1. So I'm going to take the roll. I'm going to put it right at my hip flexors. I'm going to roll from here, and I'm going to go down. So I'm going to go on the roll. I'm going to go down on you can go down on your elbows or you can go up on your hands. It depends on how the back feels. I'm just going to roll it down toward my knee, and then I'm going to roll it back. Back over toward the hip flexor, and I'm going to roll down. If you want to do a single leg, you just move yourself over a little bit so one leg is on and you have more weight into that leg, and then you're going to roll back and forth. So after you're done with that, what you're going to do is you're going to just repeat everything on the left side. Always try to remember when you use the foam roller, you want to start down at your calf and kind of work your way up toward the heart. So you're trying to increase the blood flow and the warmth of your tissues toward the heart. Thank you.